The truth is that in medical school, while I was a medical student, my mom got breast cancer. And certainly she was a smart lady and understood that there were a lot of facets to her care. But she told me during that time that having breast reconstruction was an important part of it for her, not because of how she looked, but because she knew that if they were going to go to the trouble of doing that and put her back together again, so to speak, that she knew she must have a great prognosis long term. The plastic surgeon for her was a light at the end of the tunnel, and years later I actually ended up training with that doctor. It's amazing, but I've been in practice now for 11 years, starting practice in 2005, and it seems like for every block of my career, medical school, residency, fellowship, and even as a practicing surgeon, breast reconstruction advances in really amazing ways. I think the most important thing as a breast cancer team that we can offer our patients is not just treating each cancer cell, but treating the patient as a whole. Breast cancer treatment really is multifaceted, and here at Intermountain Healthcare, we're fortunate to have a team approach. That includes surgical oncologists, the people who actually remove the cancer. That includes radiation oncologists. That includes hematologists and medical oncologists who deliver chemotherapy. It includes plastic surgeons, radiologists, pathologists. With that kind of team approach, we're trying to tailor the treatment, not just to the patient's cancer, but to her lifestyle, to her choices, to her tolerance for treatment. Some people are okay with maybe treatments that are more involved or take longer, but give them a different outcome. Others, not so much. And so we really need to know the patient as an individual and not just try to fit them into algorithms, but know that woman as an individual, know her family situation, and design a treatment plan based on those factors. Actually, I'm married to a doctor. My wife, Sarah, is a radiologist who specializes in breast cancer imaging. And so that brings a lot of that kind of talk to our dinner table. In modern cancer care, especially I think in breast cancer care, which I'm most involved in, it's unacceptable really for the doctor to be the one calling the shots or making all the decisions. The model I really try to work into my care philosophy is one of a shared decision-making format or a shared decision-making model. If I don't get to know the individual patient and her lifestyle, her family situation, as well, of course, all of the medical details, then we can't come to those conclusions and she can't be part of the decision-making with me and I can't be part of it with her. A patient who's making decisions and is involved in her care is going to be the most satisfied patient long-term, and ultimately that's our goal. I'm Dr. John Hijjawi. I'm a board-certified plastic and reconstructive surgeon specializing in breast cancer reconstruction, and I'm practicing here at Intermountain Medical Center in the Plastic Surgery Clinic.